I started coming here to have my daughter's own shoes fitted. I wanted to go for a shop that had a really good shoe fitter, and got talking to Peter and the team. And he also had some links in with Dr. Nathan Hassan, who would refer children with hypermobility and foot and gait problems to me, as well as to the shop here. It was always going to be a good idea having shoe fitting on site and being able to see children and treat their foot problems with insoles, all in one place. We're generally, when we're looking at children's foot and leg alignment and problems, we're not necessarily worried about those children who don't fit the textbook normal, but actually those children who don't function as well as maybe their friends of the same age group. So that if children have maybe limited walking, that their parents are saying, well, actually we walk for 10 minutes and then they want to be carried, they want to go in the buggy, they want to go on the scooter, the bike, they just can't seem to walk any distance. And we know some of that is a mental thing, that they're just not stimulated walking, they get bored easily, but others of them generally seem to have a tiredness and a soreness that they can't seem to achieve normal distances. When they do sports, they can't seem to actually get the power for running, or their stamina is lacking, or they get specific aches and pains. So we're looking at children that have got sort of problems that are presenting as some form of symptom, and therefore trying to improve that symptom and let them become more active and take part in everyday activities. The main thing that we're interested with is to keep all children as active as they can be and have them pain-free in that activity. So we're looking at trying to not necessarily change the way they walk, particularly if they don't need that, but just when children have got slight deviations from normal that are giving them problems, to try and actually put them back into a position that's going to keep their feet working well, keep their legs moving well, keep them strong for their growing years. We're looking to sort of maybe give some children more stability, make their heel-toe action so they're more efficient in their walking, easier, maybe improve leg alignment. So we're looking at sort of just making tweaks, changing a few positions, forces in their foot, to take stress and strain off their growing limbs. But certainly I think we are more conscious of the fact that these children have got more aches and pains, or some children have got more aches and pains and seem maybe less stable than they used to be, and so we need to sort of address those problems. So when they come to see me, they usually have a full lower limb assessment. So we look at standing foot and leg posture and sort of upper body posture. Get the child to walk up and down quite a lot so we can see how things are moving. Maybe do a bit of running as well, just to see what happens when we challenge that child to sort of something more physical, look at balance. And then they'll come into the treatment room and we'll go through all their joints, their hips, knees, feet, look at ranges of movement, look for muscle tightnesses, and then also test muscle strength in the lower limb, just to make sure that actually that they've got enough strength to be able to control the movements that maybe their joints have, if they've got any limitations, whether we need to be stretching them. So most of the children go out of the treatment area, if they've come in with a problem, with a muscle strengthening program, because we need to address any muscle imbalances that are there. Then sometimes they may need foot orthoses to improve the alignment in their feet, maybe improve some of the feedback into their feet so they know where they're placing their feet when they're walking, give them more stability, and combine that then with the footwear to support the orthoses so that the footwear is stable and controlling joint positions as well. So that's where it comes in really nicely with working here, as such that normally other clinics I work in, you sort of give them the insoles and then send them off to a shoe shop or their local shoe shop, and hoping the fitter can therefore work around the insoles. And if they can't, then the parents have then got to come back to me on another visit to talk about what the problems are. Here we can arrange for the shoe fitting appointment at the same time. They can usually take their insoles with the shoe fitters. We'll have a discussion there about what we want to achieve for that child, and then the shoe fitters will use their skills to choose the appropriate footwear. I think I've been working here now just over 18 months. Yeah, and we're seeing people coming back again for, to be reassessed, to have new insoles if that's what they need. Quite often they have improved. Usually if they're improving in their symptoms, their aches and pains, and they've gone away, we'll often remove the insoles and just stick with supportive footwear and see if that's enough to maintain them and check in their muscle strength. So yeah, in the sense that people keep coming back, we do see those successes, and often things like they might have gone from wearing an ankle boot then to drop down into normal height footwear and can just wear shoes. Because I'm conscious that children don't necessarily want to be wearing clumpy supportive footwear all the time, particularly the girls. The fashion kicks in, so it's nice to sort of let us reduce the sort of support they need so that they can try and fit in a little bit more with their friends. Contacting the shop is the easiest route to book in an appointment with me. We've also got a new online booking system about to start up, so you can log on to the shop website and book directly into any of the clinics they run here, because obviously we've got the other sports clinics and rehabilitation clinics as well, so they can book into those clinics. The appointments are an hour long, which gives us plenty of time for chatting and then the full assessment afterwards. So they'll book an hour appointment. So yes, everything's sort of booked through the shop and now hopefully booking through that online system.